Welcome back to Menopause University. This is the YouTube channel that is really a classroom, complete with the orderly sequence of material, quiz questions, charts, and reviews, just like what you had back in your school days. Now, I'm your teacher, but I'm also a gynecologist. And that comes in very handy for teaching you all about menopause and the diseases that are pertinent to it. Epithelial ovarian cancer is one of those diseases. So this is video number 429. It's the 17th video in the unit on epithelial ovarian cancer. And we've been addressing the risk factors for this disease in the last 8 videos. And this is the 9th on risk factors. You know, I always take the time to give you an individual video on each category of risk factors. That makes the information so much more meaningful and useful. You know, I could just show you a list of risk factors and leave it at that, but if I did it that way, you would never see the overlaps or the themes that help you make sense of why each risk factor is a risk factor. By dedicating an individual video to each risk factor, you learn the logic behind the things that increase your risk for the given disease. So the first thing I do in these videos on risk factors is show you the whole list. So here it is again. We have worked our way down to the red row close to the bottom of the chart. And today we're ready to address that red row, which consists of the inflammatory category of risk factors. Now, while all of chapter 32 in my book, both first and second edition, is on ovarian cancer, you will find the risk factors there. And most of the other risk factors are listed there, but this particular one is not. It is implied, and certain aspects of what you will learn in this video are present in the book, but the category of inflammation as a separate entity itself is not. This is a new category. You haven't seen this before. You haven't seen it on the list of risk factors for any other disease that we studied, not heart attack, not osteoporosis, not Alzheimer's, not endometrial uterine cancer, not cervical cancer, not breast cancer. You have seen that some anti-inflammatory foods and some anti-inflammatory medications help prevent some of these other diseases. But you have not seen inflammation itself as a standalone, verified risk factor for any of the others. So what is it about inflammation that could possibly increase your risk of epithelial ovarian cancer? Most of the other risk factors for epithelial ovarian cancer have mirrored the risk factors for breast cancer. But there was nothing on the list of risk factors for breast cancer that even came close to implying inflammation. So let's examine it more deeply here and see why it increases your risk of epithelial ovarian cancer. If you look at the risk factor category of inflammation in isolation, you see that it consists of 3 separate entities: endometriosis, talcum powder use, and pelvic inflammatory disease, which is also called PID. We'll go through each of these, assessing the reasons that they're on the list. We'll start, though, by discussing inflammation itself. Inflammation is your body's normal reaction to anything it considers abnormal or dangerous. Despite the fact that we tend to think of inflammation as undesirable, it really isn't. It's your body's way of fighting anything that it perceives as harmful. So a red, sore, inflamed throat is a normal reaction to an infection or foreign substance in your throat. A swollen, red, inflamed laceration is a normal reaction to a breach in your skin. A raised, tender, inflamed zit on your face is a normal reaction to a clogged skin pore. Every time you experience inflammation, your body is doing precisely what it's supposed to do in response to some kind of injury or threat to your body. You can think of normal inflammation as somewhat of a temporary Band-Aid. It's something that takes care of your body for a period of time. The problem with inflammation is that although it's normal, it can evolve into the realm of abnormal. And that's when the Band-Aid becomes permanent and does more harm than good. So instead of merely being a Band-Aid like this, it starts behaving more like Velcro, where it's permanently attached. So let's address each of these 3 risk factors that can transform a normal process into an abnormal one. And let's do so to an extent that explains why the inflammation can increase your risk of epithelial ovarian cancer. So first we have endometriosis. Now this is actually the second time you've seen endometriosis listed on this particular chart of risk factors for epithelial ovarian cancer. Take a look at the whole chart again. There it is in the personal history category, which is the pink section. And now it's showing up again in this red category of inflammation. But the very first thing I need to clarify is this. Just because endometriosis is on the list of risk factors that increase your risk of epithelial ovarian cancer does not mean that it causes epithelial ovarian cancer. Please, please do not extrapolate risk to cause. They are 2 very different things. Even though it's listed twice, that is not enough to make endometriosis a cause of epithelial ovarian cancer. It's listed twice because it increases your risk in 2 different ways. But because it's listed twice, and because you need to understand both of the ways in which it increases your risk, I will give you a separate video dedicated only to endometriosis as a risk factor. That will be just 2 videos from now in video number 431. So I'm not going to go into it in great detail today. I will merely give you a brief overview. Endometriosis is when endometrial tissue, which lines the inside of your uterus, travels in the wrong direction. Instead of moving downward and into your vagina, it moves upward into your fallopian tubes. Either way, it's going to make its way out of your uterus. If it takes the vaginal route, it's going to exit your body, making the lining thin, and it's going to exit your body as a period. Okay? That's what you're used to. But if it takes the fallopian tube route, it's going to go up the uterus, down the fallopian tube, and drip onto some other anatomical structure nearby. And that will be more like this. So this is the route where it goes upward instead of downward. So on my model here, all of these red dots that you see are spots of endometrial tissue that originated in your uterus. But they ended up outside your uterus in the form of endometriosis itself. It is normal endometrial lining, but it doesn't belong in its new location. And when something shows up where it doesn't belong, your body reacts to it. And inflammation is one of the ways in which your body reacts to it. But instead of confining itself to the normal inflammatory reaction that's like a Band-Aid, it evolves into the realm of abnormal and becomes more like Velcro. So it's the inflammatory reaction rather than the endometriosis itself that increases your risk of epithelial ovarian cancer. And that's all I'm going to say about endometriosis for now. I will elaborate a bunch on it in 2 weeks. The next item in this category is talcum powder use. Now, this doesn't mean that if you use talcum powder in your armpits, it increases your risk of epithelial ovarian cancer. It refers specifically and only to talcum powder that you use in your underwear. Some women like to sprinkle talcum powder or baby powder into the crotch of their underwear to keep their external genitalia dry and fresh. This became known as a risk factor for epithelial ovarian cancer after discovering that there is a relationship between asbestos exposure and epithelial ovarian cancer. And that led to studies on talcum powder simply because while asbestos isn't something women put directly in their underwear or near their external genitalia, talcum powder is. Well, when scientists conducted these studies on talcum powder, they discovered that talcum powder actually behaves a lot like asbestos. It causes an asbestos-like reaction inside your pelvis. And the way it does that is, go figure, the same way endometriosis causes an inflammatory reaction inside your pelvis. If you put talcum powder in your underwear, it can work its way up into your vagina. From there, it can pass into your cervix, which is the door to your uterus. Once it arrives inside your uterus, it can travel the wrong way just like endometriosis does and move upward into your fallopian tubes, and from there it can exit the end of your fallopian tubes and drop onto some other anatomical structure nearby. And because it doesn't belong there, your body treats it like it treats any foreign substance. It attacks it. And inflammation is your body's way of attacking a foreign substance. First, it behaves just like a Band-Aid, and then it goes too far and behaves like Velcro, adhering one thing to another very strongly. Ultimately, the inflammatory reaction converts the talcum powder into something more like steel wool. And as you can imagine, steel wool in your pelvis could create a huge mess. So it's the inflammatory reaction rather than the talcum powder itself that increases your risk of epithelial ovarian cancer. So that's it for talcum powder. And now for pelvic inflammatory disease, or PID. As its name implies, pelvic inflammatory disease involves inflammation. However, its name is also a misnomer in that it's not a disease. Instead, it's your body's normal reaction to a pelvic infection. You see, when you get a pelvic infection of any kind, your body is going to react to it, and the reaction is inflammation. So if you contract any kind of sexually transmitted infection, you will have a pelvic inflammatory reaction to it. Well, almost any kind of sexually transmitted infection, because pregnancy is the most common sexually transmitted infection. And because pregnancy is completely normal, your body does not react to it with inflammation. When you experience inflammation, your pelvis is utilizing your immune system to fight off the infection. It produces special kinds of cells that function as an army to kill off the offending agent. Pelvic inflammation becomes a disease when it festers or progresses. Instead of just killing off the offending agent and then leaving the site, the army starts spreading to nearby anatomy, and then it starts damaging that nearby anatomy. That's when it becomes a disease. And in your pelvis, that disease can manifest in a few different ways. One manifestation of pelvic inflammation that becomes a disease is when the inflammation clogs your fallopian tubes. In that case, it's like a kink in a hose. Nothing can travel down the full length of the tube. That kink impairs its ability to move. So when this happens, your fallopian tubes can get so damaged that an egg and sperm cannot use them as a highway to meet and result in pregnancy. So this constitutes one cause of infertility. A second manifestation of pelvic inflammation that becomes a disease is when the inflammation progresses to create an abscess. An abscess is a walled off area of inflammation. It's like a balloon of inflammation. And the balloon can get bigger and bigger as the inflammatory process progresses. And if the balloon gets too big, it can rupture. And a ruptured abscess spills inflammatory material all over your pelvic structures, making the problem even worse. Another possibility is that the balloon full of inflammatory materials can get so heavy that it twists. And if that happens, the tissue beyond the twist dies. Now that's just like a heart attack in your fallopian tube. So this constitutes a surgical emergency. A third manifestation of pelvic inflammation that becomes a disease is when the inflammation turns into scar tissue. You know, your body is very, very smart about protecting itself. So anytime there is a raw surface that isn't supposed to be raw, your body does something to cover up the raw spot. Inside your pelvis, all surfaces are supposed to be covered with a protective skin layer. It's the same skin layer I've taught you about in this very unit. Remember this? This saran wrap-like layer is what covers the outer surface of your ovary. You learned in video number 416 that your ovaries and all the other structures in your pelvis have this saran wrap-like skin covering them. And notice how thin and delicate and soft this saran wrap skin is. Now another name for this delicate skin layer is serosa. So serosa covers everything in your entire pelvis. The whole reproductive tract is covered in it. It's a protective coating, but it behaves just like the skin on the outside of your body. If something damages it, it becomes inflamed. Well, what happens to a cut on your skin after it becomes inflamed? It starts healing by adhering the two sides of the cut in your skin together. It's almost as if it functions as its own Band-Aid. But then it starts forming scar tissue, right? And what's different about that scar tissue in comparison with the surrounding normal tissue? It's thicker and tougher and harder. In other words, it covers up the raw damaged tissue with a thick, tough, hard skin instead of the thin, delicate, soft, normal skin surrounding it. And that's more like Velcro. The two sides of Velcro seal themselves together, and they put themselves back to back or next to each other and hide and protect the raw area. Well, guess what? The very same thing happens inside your pelvis. If an infection causes inflammation, the inflammation produces a raw area, and the surrounding tissues adhere to that raw area in order to cover up the raw spot. This scar tissue in your pelvis is called adhesions. It comes from the word adhere. So, if a sexually transmitted infection travels up your reproductive tract, this is the reproductive model, from your vagina, where you contract the infection, through your cervix, and into your uterus, and into your fallopian tubes, and then spills out of your fallopian tubes into your pelvis, it's going to create an inflammatory reaction in your pelvis. And that inflammatory reaction will irritate the serosal skin covering on your pelvic organs. And that will create a raw spot in the skin covering. And all of these other anatomical structures nearby, your bladder, your intestines, everything, will try to cover the raw spot in order to protect it. And first, that protection will consist of a Band-Aid, but instead of remaining temporarily, the Band-Aid really sticks. But when it does, it adheres. And once again, once it adheres, it cannot let go. And the ultimate result is pelvic anatomical structures that should be separate, but they become adherent to one another. There's a special name for pelvic structures that adhere to one another. It's pelvic adhesions. Pelvic adhesions are adherences between pelvic structures that should not adhere to one another. Pelvic adhesions can change over time. At first, they can be really filmy and delicate, just like the serosal saran wrap covering itself. And then that filmy, delicate layer starts to get thicker. And then it gets thick enough to be almost as thick as a Band-Aid. If the inflammation continues, that Band-Aid becomes thicker and tougher. And if it persists, the adhesions become even stiffer and harder. It's almost as if these adhesions were wet at first and then they begin to dry. It's a lot like what you see with glue or cement. With time, adhesions become really, really hard. And as they harden, they distort the very anatomical structure they originally sought to protect, as well as the one that adhered to it. So you end up with an inflammation along with distorted anatomy. One of the worst things I ever encountered as a surgeon was pelvic inflammatory disease that had hardened so much that it was literally like trying to operate in cement. It is definitely a surgeon's nightmare. So there you have it, 3 different sources of inflammation that create an increased risk of epithelial ovarian cancer: endometriosis, talcum powder, and pelvic inflammatory disease. But they represent 3 very different sources of predispositions for epithelial ovarian cancer. Endometriosis is a natural tissue that exists in your own body. Talcum powder is a completely foreign substance to your body. And pelvic inflammatory disease is your body's normal reaction to infection. And yet, they all fall into this category of inflammation as a risk factor. Okay, we will stop here today. You now know enough to make sense of why inflammation is a risk factor for epithelial ovarian cancer. We will come back to endometriosis in video number 431. Next week, we'll discuss the last category of risk factors on our chart of risk factors. If you're looking for something to do, look no further than my website, which is menopausetailor.me. Schedule a consultation with me if you want to change your life for the better forever. That's your homework assignment. Please subscribe before leaving class today and follow me on Facebook, Instagram, Pinterest, TikTok, Twitter, you name it, for extra credit. Bye!